Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Delirium. So let's talk about delirium in the DSM-5 criteria. So as per the DSM-5 and the ICD-11, the organic mental disorders, they have been given a new terminology, that is the neurocognitive defects or the disorders. Neurocognitive disorders. So the most common organic mental disorder. It is acute onset and the symptoms it develops within the hours or days, and progresses of symptoms may fluctuate. So it fluctuates. Next is there are neurotransmitters which are involved, and this leads to the decrease in the acetylcholine. Then comes the insight. If you look at the insight, it is impairment of the insight. Next, let's look at the etiology, that is the causes. It can be due to the drugs like the alcohol, the sedatives, antidepressants. Next, moving on to the endocrinal. Endocrinal, it includes the hypothyroidism. So hypothyroidism, the hyperthyroidism, and the hypopituitarism as well as the hyperpituitarism. So all this. Then looking at the liver, what do we have? Liver, there is the hepatic encephalopathy. Then comes the infections, that is septicemia and the septicemia, and also there is inclusion of the pneumonia. Then looking at the renal, there is a uremic encephalopathy. Next is the intracranial, it includes epilepsy. There is tumor as well as the presence of the injury. Then moving on, there is the metabolic. Under metabolic, there is hypoxia. Then comes the hypoglycemia and the electrolyte imbalance as well. Then moving on to others, it includes the sleep deprivation and also the presence of heat. Now let's look at the DSM-5 criteria for diagnosing delirium. So under this, there is the disturbance. So first one, A, it includes a disturbance in attention. So disturbance in the attention span. So this is reduced ability to direct, focus, sustain and shift of the attention. Next is the awareness and reduced orientation to the environment. Then comes the disturbance develops over the short period of time. So disturbance over the short period of the time, and this is from hours to few days and represents an acute change from the baseline attention and awareness, and tends on fluctuating in severity during the course of the day. Next, moving on, the additional disturbance is cognitive. There is memory deficit, there is disorientation, there is language, there is visuospatial ability or perception. The ability in criteria A and C. So the C was the addition of disturbances in cognition, that is memory deficit, disorientation, language. So in disturbance of the criteria A that we saw and the C, they are not better explained by a pre-existing established and evolving neurocognitive disorder, and do not occur in the context of severely reduced level of the arousal such as the coma. Next is there is an evidence from the history of physical examination or the lab findings. So physical exam as a lab findings that there is a disturbance in the direct physiological consequence of another medical condition, and substance intoxication. So substance intoxication as well as exposure or to a toxin or due to the multiple etiologies. To learn and grow daily like this, please do subscribe.